We're going to now move on to our fourth speaker. Great, Patrick. Julia Ryder. And Julia did her practicum with the Montana Healthcare Professionals for a Healthy Climate. And her site mentor is Lori Byron, who's a MD FAAP. And the name of Julia's presentation is Climate Change and Human Health in Montana.
So I'm just looking for my button to share screen. There was one earlier. Just trying to figure out how to share my screen. I'm so sorry. Patrick and I had it before we started.
Try hovering at the top.
Okay. Let's see here. I'm so sorry, guys. We had it all worked out. Sorry, Patrick. My screen's even up. I just don't have that button that says share screen.
Down at the bottom, there should be a green button that says share screen.
There she is.
Got it.
Oh, great. Thanks, Patrick.
Thank you. Okay. And then let me just put this into slide mode. Okay. Well, thanks, guys. Sorry about that. Yeah, like we said, my name is Julia Ryder. I've been a nurse. I started as a nurse in Bozeman, Montana. I work in the emergency department for about 13 years, and I have a deep passion for how climate change affects human health. I got the opportunity to do my capstone with Lori Bryan, who her and her husband started the program, Montana Health Professionals for Healthy Climates. And I just love their organization. So my work with them gave me the opportunity to complete some fundamental competencies. I listed them here, and I know a lot of you know them, but through the work I did with them, I was able to discuss the means by which structural biases, social inequities, and racism undermine health, create challenges for social inequity. I was able to assess population needs, assets, and capacities that affect community health. I was also able to advocate for political, social, and economic policies to improve health in diverse populations. I had to go through multiple different communication strategies for different audiences, and I was required to perform effectively on interprofessional teams. My generalist concentration, specific competencies that Montana Health Professionals for Healthy Climates gave me the opportunity to do was explain the challenges associated with provision of environmental health services for rural areas, and have to demonstrate a basic understanding and respect for the multiplicity of values, beliefs, traditions, experiences, feelings of satisfaction, some from social determinants in rural settings. So I'm going to pop to my first project here. My first project for Montana Health Professionals for Healthy Climates was to create a poster for their conference in Helena, Montana, their 406 conference. And my job was to research and then explain the risk that climate change has to fetal maternal health. This poster, this project was very cool for me because I got to go to the conference, and allowed me the option and the ability to discuss social inequities that are faced in Montana. What we don't realize that in Montana, many homes don't have air conditioning, and to add air conditioning to a home can be very costly. And this is not an option for many people. But as the heat rises, as we have more heat waves and we have more wildfire smoke, many homes become unsafe. And to make the social inequity even more challenging is that Montana does not have safe places for people to go, such as cooling centers or clean air centers. Using the research that I did on climate change and fetal maternal health, I then took the next step for healthcare professionals for healthy climates as an educational outreach, and developed two separate handouts. And this is where I'm working with two different audiences. The first one was for providers, which is very important because it's going to be different than for patients. As you can see, for providers, each of my information is cited. And the study that I used, whatever study I did for each piece of information, by citing my research, a provider can look up more information and also feel confident that the information in the handout is accurate. This handout also includes guidance for providers on how to assess a patient's capacity, their assets, and what they need in order to prevent experiencing negative health effects from climate change. And the communication strategies here is that it's very different to communicate with a provider about this information than it is for a patient. And this is my patient handout. So this handout was developed to either hang on a wall in a clinic for patients to look at, or the option for patients to bring home and read. It is neutral of any biases, beliefs, or social status, and the focus of the handout is solution-based. So the power goes back into the patient's hands. It increases hope in the face of climate change and all the negative things that can happen. All solutions that we offer and that I've come up with for patients are free, and they're helpful no matter race or income. I'm kind of flying through it, but I have 10 minutes and I want to make sure that I cover all the projects I did this semester. So I'm trying to make it simple but clear. So the next step for Montana health professionals was to develop an outreach campaign. We have all this information to share, and not everyone gets access to the internet, which we know with rural settings, or they just don't have time. So how do we reach other people? So in order to do this, we had to research the best way to reach target populations, rural versus urban. So I took the opportunity to write a literature review for this. And in the review, I acknowledged that rural communities have different resources, social stigmas, and education levels than urban communities. Communication in urban areas is often through technology, but in rural areas, face-to-face interaction is expected. What resources an urban community has, such as a federal air quality monitor, many rural communities in Montana don't have. So they can't just access. So what's on their phone, they look at their phone of air quality, that's not accurate for our rural communities in Montana. At the very end of this slide, you'll notice that I listed the diffusion innovation model. And that was important for Montana healthcare providers because it helps us give a model that explains the pattern in which speed new ideas spread to help us not be discouraged if some of our education is harder to get across than others. I also included the Healthy Start Toolkit that we found, and I listed this because from the literature review, the Montana Health Professionals for Healthy Climates decided that the Healthy Start Toolkit will be the best guide and use the most resources that work in Montana to develop an outreach program. Again, I listed my objectives. I had to sneak in a horse, because it's Montana and I have horses. But again, the literature review is really interesting because Montana can be very, very urban in Bozeman or Missoula, but also incredibly rural. So to assess population needs was a really big deal because often rural communities don't have as high as income level because they're ranchers or they're living in smaller towns, but they're more prone to wildfires. I also had to select communication strategies because as we know, the communication can be different, very different. And then explain challenges such as poor internet, poor transportation, belief systems are very different between rural and rural areas. And then just be really understanding of different values and traditions. As the semester winds down, and I'm really enjoying my next project that I've started right at the very end of the semester, I began helping Montana health professionals for healthy climates on their webpage for wildfire smoke. I developed 2 pages to start, and this page, as you can see here, it was developed for health professionals who are not directly at the bedside. So whether you work in a clinic, public health, your administrator, we called it the administrative website. And the solutions here are more focused on social and economic programs. So we're advocating for political and local change. We talk about cost that wildfire smoke can increase in healthcare, because that will directly affect if a clinic or a medical center can stay open. And then programs. I did not always come up with all these on my own, but one cool thing is having a smoke awareness week, asking places that have open rooms or safe rooms to develop clean air spaces, or cooling centers, offer a place where people can go, especially pregnant women or women with disease processes can go to find a cool place if they don't have air conditioner. The next tab is a quick overview. And in my portfolio, you'll see it's actually a white page. So it's a report, and this was specifically for providers. This report asks for urgency from healthcare professionals, but specifically providers who work with patients directly, of awareness of how wildfire smoke affects us and makes us sick, all our patients, but so much the people on medications, people with comorbidities, and our children. And the solutions provided are, again, very affordable solutions. You'll see a picture here of how to make your own HEPA filter for your house by taking air filters and putting it to a box fan. Providers can guide patients on this, but they can also teach patients how to wear an N95 and where to find their local air quality through phone or school flag systems. Again, I met the objectives I've talked about because we have such social inequities across our state. We have a lot of challenges to reach people, and it will take political, social, and economic policies to help support wildfire smoke health of these patients. My next step is to continue to work with Montana health professionals as volunteer, even if I'm not completely focused on my capstone. I love the work I do with them. I don't want to leave them. So I'm going to continue to assist on the education campaign for wildfire smoke for their website. And then I'm going to continue to assist them. I think Lori is okay with it. I think she's on here, but just the educational campaign on climate change and human health as well. So that's it. But thank you so much for your time and for listening. I appreciate it.
Great job, Julia. Thank you so much. It's actually a great transition to